to Nonprofit Executive Spotlight, an occasional series presented by Rogue Tulips Consulting. I'm Cecilia Supp. I'm the principal and founder of Rogue Tulips Consulting. This episode, I am pleased to welcome Sally Cook, who is a CMP CHPC, and she is looking for her next opportunity to bring all her skills, knowledge, and expertise to another nonprofit healthcare-focused organization. Sally, welcome to the show. And can you tell us a little bit about yourself?
Yes, thank you for having me. I am an association educational professional that has over 10 years of experience, specifically in continuing medical education and also continuing pharmacy education in a ANCC, which is the nursing credit.
Sally, in the introduction, I mentioned that you are a CMP, and most of us know that's certified meeting planner, but many of us do not know what a CHCP is. That sounds like a pretty important certification. Can you tell us a little bit about that?
Yes, I'm a certified healthcare education professional, and this means that I have knowledge of competency level learning and helping to develop content for live and enduring materials. I also have the ability and knowledge to build evaluations and outcomes that will lead to proving return on investment for the organization.
So what gets you excited about that?
Oh, I really just enjoy being a team player. And also when I get through with evaluations and outcomes, it proves that I have done something in the community to help improve patient care.
When you look at what you do, helping improve patient care, how do you see that in the community? So, for example, do you see people getting better healthcare because of what you do with the content you help create?
Actually, it's just learning how to do different types of things. I did have a friend once who explained the different levels of learning through a glucose meter. And let's pretend like we have a new glucose meter out on the market, and the pharmaceutical company needs to present it so that it does get out into the community to the patients. And so the company or the organization will build a content to help teach the physicians on how to use this glucose meter. And you can evaluate by knowledge level learning that the physician only knows about this new glucose meter and how to use it. And then there's also the competency level learning where you can evaluate through testing processes that they can know that they know how to use that glucose meter. But then there's also the performance level learning that you can prove that you go back about 6 months later and you ask the physician if they're actually putting it into the patients, giving that glucose meter to the patients, and are the patients actually using the glucose meter to understand their A1C levels.
Well, that's an excellent example of the glucose meter and how what you do helps people and can be measured. But one of the other things that makes me think of is how do you approach measuring those outcomes in the education? That was a great example, but how do you measure it across the whole group of people with the education?
In the past, I have had quality improvement departments that have been able to give me some statistics and be able to get that information. If you don't have a quality improvement department, it's a little bit more difficult, but you do have to do focus groups or other ways in which you can reach out to the learner and see if they actually are utilizing that information.
So you do direct follow-up with people sometimes?
I do, yes.
Okay, well, that's great. So it sounds like you really know your stuff when it comes to content development and delivering this quality education to people. So What do you think about ROI? Do you feel that you can bring ROI to an organization because you can do these programs and do them well?
Oh, sure. Yes. When you do an evaluation, even something as simple as the evaluation, you can actually show that there has been something that the learner has learned from that activity and been able to utilize it. And that does show that there is comprehensive learning and that they are able to move forward with that information. And they may not be utilizing it in their practice, but at least they know it exists. And that is a good return on investment for the organization.
So I want to clarify for myself and the audience. So when you say ROI for the organization and you're talking about the content being used or the education being used, do you mean the organization like the nonprofit you will be working for, or do you mean the actual healthcare practice?
Directly referring to the organization. And
Okay.
that's because they put a lot of money into the educational program. And it 5 years down the road, if you're looking at an enduring material and you realize that nobody is utilizing the enduring material, nobody is taking the tests, nobody is doing the evaluations, nobody's taking the CME, that really doesn't utilize your time and efforts as effectively as if you have a product where everybody's using it, everybody wants to look at it, and everybody wants to get their continuing education credits through it.
So you focus on the content development and delivering the education. But what you just said made me think, do you work with like in a cross-functional team for marketing so that people know that all of these wonderful materials are available?
Yes, with the accreditation process, there are certain steps that you need to advertise, and that would include something like the learning objectives, the target audience, the dates, the times, and how much credit that you're going to be offering for that organization or for that activity.
Hmm.
And that is the way in which I work with the marketing department.
So can you tell me a little bit about your approach to teamwork? Like, do you have a philosophy?
Yes, well, I actually like to do some teamwork and from a smart sheet or a base camp perspective, and make sure that have a network that you can put your work that you have done for the day into the process so that everybody else can know what everybody else is doing. I also think it's important to do face-to-face activities or meetings so that you know that everyone has actually done, because everybody knows that those smart sheets or the spreadsheets can go a little awry when things are really busy. And so if you're doing face to face, you can get everybody online and be able to do that.
So what do you love about working in the nonprofit area?
I do enjoy working in the nonprofit and the association world because I do enjoy the members, and to be able to talk to them and know what their specific areas of expertise are. I do enjoy working with the staff because it really shows that everybody is on one page and working for a good strategic plan, a good vision, and a good mission. And as long as everybody's on board with that, it really makes a great team.
And you've mentioned that you would like to work in a membership association. So
Yes.
are you looking for a professional society or a trade association?
I think I would like a professional society. It makes it a lot easier for me because I do know what their profession is. I do know what their areas of expertise is. And so I do enjoy that part of it.
Well, Sally, is there a certain healthcare professional that you would love to work with? Or do you just love working with all healthcare professionals?
Because the industry is the way that it is, I do like doing joint accreditation now. I do like having to present that each activity is working with a team. And the basis for joint accreditation is physicians, pharmacists, and nurses, but you don't have to, those are the anchors for the joint accreditation process. They can have other organizations that are part of it. I used to work for the American College of Radiology, and they could possibly work with the radiologist for the CME credits, but also the ARRT for the radiological technologist credits as well.
So you really like bringing different groups of people together.
I do, yes.
I think that's a wonderful approach because, as we know, in the nonprofit management profession, it really is the relationship industry, and it's bringing people together to work together. So we've talked about a lot of things as far as what you do, your knowledge, your skills, what you love about working with nonprofits, and what kind of group you would like to work with. So what kind of a position would you be interested in finding at this point?
Yes, I like to be a manager. I like to be the worker bee. I don't necessarily like to give the direction, and I like to fulfill the management role. And that would include working with the subject matter experts and helping them to develop their content and interactive learning. I also enjoy working with the evaluation committees and helping to make sure that everything is running smoothly. And if something isn't running smoothly based on what the evaluation committee says, then we go back to the project managers and talk to them about what they need to do to update the process.
So that's great. You have a very clear idea that you want to be part of a team, but not necessarily the team leader. Is that accurate?
That is correct, yes.
Great, because all teams need all of these positions and roles filled. And that's very clear. And it sounds like you are a leader anyway, even if you may not have the title or
Yes.
the responsibility that goes with that. Well, Sally, it's been great talking with you on this episode. And how could people get in touch with you if they want to talk to you about adding you to their team?
Yes, the best way to get through to me is through LinkedIn. And my LinkedIn profile is Sally A. Cook. It's SALLYACOOK.
That's great. Well, reach out to Sally if you are looking for someone who really understands how to create and deliver educational content to healthcare professionals. I encourage you to reach out to Sally Cook and add her to your team before somebody else does. Thank you for joining us this week for Nonprofit Executive Spotlight. We'll be back again unless everybody gets a job.